All right, so now I'm gonna discuss some treatment options for hallux limitus and hallux rigidus. So for hallux limitus, what we can do is we can build an orthotic that we make a first ray cutout. So we try to we cut out that area to increase the range of motion of that first MTPJ. Now, if that doesn't work, we could do an injection where we inject into the big toe joint. And if those things don't work, then there are surgical options. For surgery, what we usually do is we do a decompression osteotomy. So in this x-ray, you see how now, because I decompress the joint, there's now more joint space and that patient has a better range of motion. What I do is I make 2 cuts and then we take out a piece of bone and we decompress the joint and put 1 screw. Patients usually do really well with this. Now for hallux rigidus, because there's no range of motion, in the orthotic, what we do is we put it's called a Morton's extension. You could see it there. And then we put a top coat over it. And what that's doing, that's trying to limit the motion of that joint because the joint doesn't have any motion and it's very arthritic. So any motion is very painful. And also with hallux rigidus, unfortunately, because there's no motion in that joint, the next thing to do is just to fuse the joint surgically. Now, sometimes I have patients that come in and they're like, what shoes work best for these kind of conditions? So for hallux limitus and hallux rigidus, I often recommend Hoka's. What you want is a rocker bottom shoe. So if you see down there, do you see how the big toe, it's curved up in the shoe? That's helping you propulse through the shoe without needing as much range of motion from that joint that gets painful when you have hallux limitus or hallux rigidus. So I often recommend those type of shoes. It doesn't have to be that brand, but what you want to look for is in that picture, you see how that toe is off the floor. It's already giving you that propulsion. Hope this helps. Like and follow for more.